Hello, this is Blake Wandersea here, and for my BIOL 105 lab final project presentation, I will be doing it on the barriers to dental care for children with autism spectrum disorder, or ASD. And this is an area of research done by Dr. Sawicki's lab at the University of North Carolina, Adams School of Dentistry. What is autism spectrum disorder? ASD is a lifelong disorder that is characterized by symptoms of deficient social communication and restricted, repetitive, and inflexible patterns of behavior. Social communication deficits include decreased sharing of interests with others, difficulty appreciating their own or others' emotions, aversion to maintaining eye contact, a lack of proficiency with the use of nonverbal gestures, scripted speech, interpreting abstract ideas literally, difficulty making friends or keeping them. Restricted interests and repetitive behaviors include the inflexibility of behavior, extreme difficulty coping with change, being overly focused on niche subjects to the exclusion of others, and also expecting others to be equally interested in those subjects. Difficulty tolerating changes in routine and new experiences. Sensory hypersensitivity, which a good example of that is they like to avoid loud noises. Stereotypical movements such as hand flapping, rocking, spinning, and also arranging things, often toys, in a very particular manner. The need for service and support typically becomes more consistently visible by the time a child with ASD is 2 or 3 years old. Treating individuals with ASD. Some effective treatments include social skills training, which is in group or individual settings, which helps improve their ability to navigate social situations. Speech and language therapy, which can improve the child's speech patterns and understanding of language, and occupational therapy, which addresses adaptive skills deficits with daily living activities. Special education services, which are special classes for children to address their needs. And finally, medication, which can be prescribed to reduce behavioral interventions. The difficulty in treating patients with ASD in healthcare. Some factors include communication challenges, sensory sensitivities, lack of understanding from healthcare providers, anxiety related to unfamiliar environments, and varied presentations of ASD symptoms. Some challenges in communication are when people with autism might find it hard to explain what they need or how they feel. They may use body language differently or take questions very literally, which can make it tough for doctors to understand their condition fully. Sensitivity to sights and sounds causes many individuals with autism to be super sensitive to things like bright lights, loud noises, or strong smells. These experiences can make doctors' visit stressful or uncomfortable, making it harder for them to participate in treatments or procedures. Also, not all healthcare providers know enough about autism. This can lead to misunderstandings, making it harder to connect with and support patients with autism effectively, meaning that doctors need more training. There's also anxiety about doctor visits. Hospitals and clinics can feel overwhelming and unfamiliar, which might cause anxiety for someone with autism. This can make it harder for them to focus on their appointment. Autism is also different for everyone. It looks different in every person. Some might have mild challenges while others need more support. This means that medical care needs to be customized for each individual. And finally, managing appointments can be hard. Keeping track of appointments, remembering instructions, or dealing with complex healthcare systems can be especially tough for people with autism because of difficulties with planning and organization. That leads us to green light versus white light exposure. In healthcare settings, white light is used for the most procedures due to its neutral color and ability to provide good visibility. Green light has specific applications including calming effects, reducing pain perception, and improved visual clarity, and it may positively impact mood regulation as well. Some special uses for green light is in surgery. Some surgeons prefer green light during specific procedures because it can make blood vessels easier to see. Also for pain relief, some research shows that green light might help ease the pain by triggering the body's natural pain relief systems, which could be helpful for people with chronic pain or ASD. Things to keep in mind. No matter what color, the brightness of the light needs to be just right to ensure the safety and effectiveness. Also, patients may have sensitivities or preferences for certain lighting, so it's important to consider what feels best for them. Some lights, such as blue tinted ones, can disrupt sleep patterns. This is important to think about, especially in settings where patients need rest. This lab is studying the potential effectiveness that using green light could have for safe and effective treatment of individuals with ASD, specifically in dental care settings. Why does this interest me? I want to go into healthcare and to serve the underserved. If we could find a way to treat and heal everyone, no matter their shape, size, color, weakness, or strength, that would make the world a better place, and this is my goal. I have served passionately in children's ministry and for a nonprofit called RSI, which serves individuals with mental disabilities such as autism in order to help them live healthy and independent lives. This motivates me to want to continue pushing for ways to adequately serve those who require special care and attention, and that's exactly what this lab is doing. Thanks.